Good afternoon, everyone. It's great to see so many of you. I'm Jill Kagan with the Arch National Respite Network. We're delighted to have you at our Respite Voucher Learning Collaborative meeting today. I think it's going to be a really informative session, and I'm really glad that you were able to join us. I'm going to share my screen so you can have a few announcements from me, as always. I always have something to share with you. Again, I want to welcome everybody. Please feel free to put your name and the state you're from in the chat. And if you like, in a few words, let us know what you're hoping to get out of today's learning collaborative, or if you like, share an update about your Respite Voucher program. In case we don't have time to do a lot of sharing at the end, that would be great to have it in the chat. After a few announcements, we're going to be talking about the pros and cons of reimbursement strategies that are frequently used in respite voucher programs. As always, we have some really wonderful presenters from within our own network. And if we have time after the three presentations and the Q&A, we'll break into small groups, or if there aren't a lot of people, we'll just have one larger group discussion. And I did send you a discussion guide in advance, but if you didn't receive it, it can be found at this link on the slide. And I'll put that in the chat in a minute as well. As always, I have some announcements. I want to remind everyone that we're very, very excited to be releasing our cultural and linguistic competence assessment for respite organizations next week. Tawara Good from the Georgetown National Center for Cultural Competence will be presenting the tool and the guidebook that goes with it, and walking us through the guide, answering any questions, responding to comments. So we hope you'll be able to join us for that. We are requiring a pre-registration for this event because we advertised it very widely. So please don't forget to register at this link in order to get your Zoom connection information. Another reminder that we've now added the virtual component of the Lifespan Respite Grantee and Partner Learning Symposium. For those of you who are able to travel to the 2024 National Lifespan Respite Conference in Albany in May, we will also be holding a Grantee and Partner Learning Symposium the day before the conference on the 21st. But we decided that for those who couldn't travel, that we would share the bring, brag, and borrow sessions that everyone loves so much. And if you don't know what those are, I will be sending you instructions on how they work and what they accomplish and what they're for. But we're going to do that virtually over 2 afternoons in early May, May 7th and 8th. And again, it would be great if you pre-register for that event so we know who's coming and we can organize your bring, brag, and borrow presentations by topic. Does anybody have any questions about either of these events?
Jill?
Yes.
I registered twice. Is the registration link for both days for the bring, brag, and borrow, or do you have to do it twice?
No, you just have to do it once. It's the same link.
Okay, well then I'm coming twice because
the system can handle that. Don't worry.
Okay. But there'll only be one of me.
Yeah, it's the same link for both days. So I mean, actually it's good to register twice so we have you down for both days. But it's just one link. I apologize. You should register separately for both days, but it's the same link.
Okay, well, it puts them on my calendar for different days, so that was good anyway.
That's the other good reason to do that. Any other questions? Not seeing any. We will move on to our presentation. And as I said earlier, today we're going to be talking about reimbursing families for respite care, which I believe is a strategy that's used by the majority of the Lifespan Respite Voucher programs. But some have said it may be a barrier to using respite for family caregivers who may not have the resources to pay upfront for care, then wait for payment later. This issue came up at the Respite Summit to advance the respite actions in the national strategy that was held last month in Washington, D.C. The summit, for those of you who weren't familiar with it, was convened by the National Academy for State Health Policy in collaboration with ARCH. And I was really delighted that so many of you applied to come to this event and were selected to participate as part of a state team. We had a lot of really wonderful discussions at that event, but the issue of reimbursement around respite vouchers came up, and it really seemed to resonate with many in attendance. And I thought, this is a discussion that's really worth having with our learning collaborative, and is worthy of further discussion. So I immediately went to the respite voucher experts among us, and we have so many. But the three that are with us today all have slightly different models for paying for respite. So I thought it would be very instructive to hear how they came to select that particular strategy and what they feel the pros and cons are. And we never tire of hearing from these three. They seem to function as our leaders in the voucher world because they have so much good work and experience to share. But we're really delighted that we have Lisa Schneider, who's the Executive Director of the Respite Care Association of Wisconsin, Barb Kumjian, who's the Project Coordinator at Lifespan Respite Washington, and Aida Stevens, who's the Executive Director of Sooner Success in Oklahoma. And again, each of them are going to discuss how their model addresses the challenges that might be imposed by reimbursement strategies, and share the pros and cons of the approach that they chose and why they chose it. So I'm going to turn it over to you, Lisa, as our first presenter.
All right, see if I can do this without any issues. Can you all see my screen?
Yes, perfectly.
Wonderful. So hi, everyone. Happy to be here today. And I'm going to give an overview of our Caregiver Respite Grant Program, or CRGP. So when I say CRGP, that is what I'm referring to, so I don't repeat that mouthful every single time. And I want to talk a little bit about how it promotes self-direction and flexibility, and then the pros and cons of the CRG model. So we'll do an overview and a summary of the program itself, and then we'll showcase a little step-by-step application process. It's an infographic, so I'm not going to go into detail, but it is available for people to review it if they would like. Also share some of the CRGP disclaimers and acknowledgements that we have all parties involved having to acknowledge or check a box that they understand. And then I'll go through some of the pros and cons of our CRGP model that we have. So on a high level, our CRGP program is a GAP program, and it's available to support family caregivers who are ineligible for other caregiving support programs. We've only got a little bit of time, so I'm going to do really high clip notes on this, but you guys will have access to these slides, so you can go back into the details if you'd like. The program operates with a high degree of flexibility and self-determination, empowering caregivers with choice and control over who will provide respite services. What's important to us is quarterly random CRGP audits are conducted by our CAW staff to ensure accountability. And reimbursements are made directly to the applicant, who in turn assumes responsibility for compensating the hired respite care providers. Flexibility is maintained for payments to agencies or facility-based programs, in that we can pay the agencies or the facility-based programs directly without having to go through the paying the family caregiver. However, they're still subject to completing a W-9, which I'll talk about. The applicant will be held accountable if the respite provider of choice cannot verify that they were paid funds for their respite care services, or if our CAW suspects that CRG program funds were used fraudulently. Sorry, I have a cold. I have COVID, so I sound a little stuffy, and I apologize for that. Reimbursements typically follow the provision of respite care services, though exceptions can be made in cases where financial barriers or emergencies exist, where grants may be dispersed prior to respite care service delivery. It really doesn't change our process much, but there's got to be certain conditions met in order for us to pay in advance of the services. Especially when people are having persons with high acuity levels, like nursing care level And we provide grants for up to 5 days. So if somebody's going to put somebody into a nursing home for 5 days, you could be footing a $2,000 bill, and we pay that amount. So people aren't able to pay that up front. So as I was saying, currently there's no cap on the supportive caregiver that the supportive caregiver can receive annually each time that they apply. And they can apply right now every 90 days, 5 days worth of respite, consecutive days. So the applicants can apply for up to 5 consecutive days of 24/7 care, or they can do 5 days of 8 hours a day, whatever mix that they want, but they just need to be consecutive days within 30 days of the grant approval. Again, we're not a voucher, we're a grant program. With the additional supplements that we have for our emergency and supplemental respite grant programs. There is no household income threshold for eligibility, and the program is available to individuals across the lifespan. All applicants must provide a W-9, and those receiving $600 or more in grant funds in a calendar year will receive a 1099 miss from RCAW. Denial of applications is possible, with applicants having the right to appeal using the grant denial appeal form and utilizing the established appeal process that we have. So here's that little step-by-step infographic, I guess, and it just kind of gives you the yin and yang of it. But at a high level, we've got 4 players involved, and so we've got the primary family caregiver, the care provider of choice, either a county or an ADRC or tribal ADRC plays a role, and so does RCAW. So there's 4 people playing a role in our whole process, and so it really is a good way to mitigate any fraudulent type use of the funds, because we've got 4 different sets of eyes on it, and we've got 5 different forms that we use throughout the process. So there's an eligibility criteria form, there's a supporting documentation form, there is the application itself, then there's the grant report form that's done after the services have been provided, and then there's the caregiver experience survey, and applicants have to complete all of those in order to reapply again in 90 days. So some of the disclaimers and acknowledgements that we have, at least 3 of the 4 players, because RCAW is RCAW, but the county or ADRC, the provider, and the family caregiver all have to understand that that RCAW is not the employer, and nor do we provide any direct or indirect services. Ensure the purpose and intent of the grant, so that it's not used for anything else but direct respite. The employee relationship is between the applicant and the provider. To remind the applicant that they are responsible for conducting a background check. Confirm that RCAW will not pay individuals, workers directly. Require the providers to sign the grant form to attest that actual care was provided and that they were paid. Have the applicant and the provider sign off on the grant form, agreeing to hold harmless and indemnify RCAW and all of its yada yadas. Understand that the RCAW reserves the right to deny an application if it's suspects or detects fraudulent information. And we've caught that once, and it was interesting. Acknowledge that RCAW reserves the right to support suspected fraud, the appropriate officials, and know that all parties involved in any grant fraud can potentially be charged with government grant fraud. And we have a little thing for them to go and review just so that they're fully informed. We do reserve the right to refuse an application or award a grant on a lesser basis than requested. We do have an appeals process, and so there's a form to fill out, and we've got a process that applicants can appeal the decision that RCAW made. So some of the common areas of the pros and cons that I'm going to go through with our CRGP model is in the area of spending limits, time limits, rate setting, provider of choice, and consumer feedback. So in regards to spending limits, our model does not impose a dollar amount within a specified period. Naturally, this is contingent upon funding availability. Right now, people can apply every 90 days. The con is frequency at which applicants can reapply varies Currently, it's every 90 days, but sometimes it's been 120 days. Sometimes it's been 180 days. And for a brief period of time, it was for 60 days. So they have to constantly be watching that because we just never know what funding we're going to have from year to year. But we believe in getting it out and not asking for any carryovers and having any unspent funds. So that's why we up the frequency or reduce the frequency. In regards to time limits, the RCAW policy requires applicants to request respite for up to 5 consecutive days to occur within 30 days of their approval of their grant application to ensure timely expenditure of funds. And that's a big difference with some vouchers is, again, we don't want to carry over any funds or be concerned with having unspent dollars. Con is, though, that before the grant is approved, the applicant must have their dates identified, their rates identified, times of service planned, and rather than being able to spread it out over the 30-day period, some wish, why can't I spread it out 1 day a week over the 30-day period? And it's just not how our model works. But again, they can apply every 90 days. So it's pretty good on that standpoint. In regards to rate setting, CRGP empowers caregivers by allowing them to determine the rates of pay for their respite providers. When care is provided by an agency or facility, the rate is set by that provider agency. And if the rate significantly diverges from the prevailing market rates, we will dig into things a little bit further and maybe negotiate a lower rate. The con is in instances where overnight respite is requested, we may propose utilizing a stipend if the respite care provider can rest while the care recipient sleeps. However, if the provider must remain awake at all times or they have different teams coming in, we will pay an hourly rate. Another area is the choice of provider. Applicants have the freedom to choose their preferred provider. The con is we typically do not directly compensate individuals directly, which is an extra step for an already overwhelmed caregiver. To me, it's hardly a con, but yeah, it can be a little bit more burdensome. On the flip side, though, if there is an issue, we will pay upfront for their respite care services again, because we don't have that maximum amount that they can have as long as it's within reason and in correlation with the acuity of the person being cared for. So if it's high acuity nursing home or SNF level care, we're going to pay that higher amount, which a family caregiver is probably not going to be able to pay upfront. And then in regards to consumer feedback, we diligently gather feedback through a caregiver respite experience survey from every applicant. We highly value this input as it informs our program model improvements. Yet a con is that we're requiring the family caregiver to complete yet another task in order to reapply for the CRGP grant program, and it may be burdensome for them to do so. But it really cues them up again to apply again with us. And that's kind of our CRGP in a nutshell. So I think we're going to hold off questions until all three of us have presented. I will turn it back over to Jill.
Thank you so much, Lisa. That was an incredible amount of information. And I didn't even realize how detailed your program was in terms of administrative protections. So that was really fascinating. As Lisa said, we will hold all questions until everyone has had a chance to present, but please feel free to put your questions in the chat so you don't forget them. We'll be monitoring that closely. Okay, I'm now going to share my screen and turn it over to Barb.
Thanks, Jill. And I too am kind of overwhelmingly impressed with Lisa's presentation, that so many details were provided, and my slides are a little less detailed, but of course you can pop any questions right into the chat. Well, our program, Lifespan Respite Washington, LRW for short, we are a voucher program. We make direct payments to the providers. I'd have to call our program sort of a modified self-direction in terms of the people who get the vouchers, the caregivers. Our whole program is based on state requirements for training, background checking, and liability coverage. And that limits us. We are not allowed to pay individual providers, no matter who they are, even if they're family members or friends. We can only provide payments to organizations. So, and not individuals. And we'll get more into that as we go along. Next slide, please. So we provide a wide variety of respite services because we contract with organizations across the state, and they might be in-home care providers. They could be recreational programs that serve individuals with disabilities. Day and overnight camps are hugely popular. Out-of-home day programs. When we say retreats, we're talking about like family retreats where the whole family goes to a location and gets all these activities scheduled. But the caregivers have slightly separate tracks from the individual receiving care, which provides sort of it's respite, but also with family time. We also offer with other organizations certain types of classes, therapeutic programs. Equine therapy is huge in Washington State and is one of the favorite forms of respite requested for both adults and children. So next, please. Well, how does it work for the caregiver? We have far fewer organizations or agencies in the mix. Basically, it's just us. And that's because for caregivers, it's a very simple process. They apply online and there is an eligibility review. And basically, we do not ask for income documentation or documentation of a medical condition or anything of that nature. What we do check for is, are these people receiving respite care from any other publicly funded or private source? Because we cannot fund them in that case. For example, if they are getting respite services through a Medicaid home and community-based services waiver, that's a typical example. We always do run a wait list, but people are eventually awarded if they're not declared ineligible during the eligibility review. And at that point, they are free to choose a provider, but a provider on our registry. More on the registry later. And the registry includes all those types of organizations I mentioned earlier. And after services are provided, or in the process of providing services, the provider bills us and we pay the providers directly. And during the time period when immediately after someone is awarded, and right throughout their voucher time period, our team provides extensive one-to-one supports, especially when it comes to selecting the provider. That's often where our caregivers get stuck. There's, they may not have considered all the questions they have to ask, or there may be difficulties finding a provider that has availability. That's typically one of our stuck or barrier areas for our caregivers. Next slide, please. And this is a couple of screenshots of what our website shows families When the caregiver has been awarded, they can either go on our website or we send them a printable list. And the website has a search function here. And if you look down at the lower image, and you can see text with all these little plus signs, and people can search by the county they're in, or if they're near a county border, they can select a couple counties. They can talk about the type of respite they're looking for, whether it's in-home or a day camp for the kiddos. The ages served, are they looking for respite care for a child with a disability? Are they looking for, a senior person? Many agencies offer specialty services, so people can select what population they're looking for. Is it someone on the spectrum? Is it someone who has a mental health condition? A person who's had a stroke or is coming out of rehab? The respite services provided. Does an agency provide 24-hour at-home monitoring? Or, does a camp provide accommodations for food preferences or allergies? So next slide, please. And how it works on our end. Now, respite providers, we recruit the providers across the state, and we maintain that searchable registry. And we have an agreement or a contract with the providers. We do pay the rates that they give us, whether it's $45 an hour for in-home services, or it might be, $500 for a week at camp. There is a provision in the agreement that if fees seem excessive, that we will investigate. And we also offer an incentive to agencies and organizations in terms of, they can charge us 10% of the total voucher amount up to $100 to help them process and, handle the paperwork and so forth. Most of them don't actually want to give us that, ask for that money. They're like, oh, we're doing good work here. And it's a voucher program in the sense, you might call it a grant, but it's a voucher program because it's only good for services for providers in our registry. So in that respect, it's a voucher. When someone is awarded, the voucher funds are set aside. The provider sends us invoices and we approve them. And we have to track all the payments for audits. Now, our program is very different from the one you just heard about. We have time limits and dollar limits for the vouchers, and also reapplication limits. Families receive the usual voucher amount is $4,000. They don't have to use the whole thing. And we can recycle the funds. In other words, if somebody gets $1,000 and they use $700 of it to send their 2 disabled children to camp, then we can take that extra $300 and put it back into the pool of funding and re-award it. And I just lost my train of thought. Excuse me. Yes, so in the time limit, we ask that recipients of the voucher try to use it within 90 days. This obviously does not work in terms of situations like summer camps. So we have extensions for people looking for that sort of respite care. So basically, it's very simple to apply, but the program itself is really kind of structured. And, you know, there's not a need to keep looking at, you know, is it time for me to apply? Is funding available? People can reapply, but they have to wait a year to do so. And we still managed to get through quite a few vouchers with this setup. So we can go on to the next slide, please, Jill. Okay, so as far as we know, based on the evaluations that we get, we do surveys just like everyone else. People appreciate all the different types of respite that are available. They appreciate the support we give them, the one-to-one support by phone or email. They appreciate the fact that there's no paperwork and taxes don't come into it because the voucher recipient never handles any money whatsoever. They appreciate the flexibility to use the voucher during different time periods. And even though they have to wait a year, they still appreciate the fact that they can reapply. Now, one thing that I think is kind of interesting about our program is what we call the bring your own provider option. Lots of times we will get asked, you know, oh, we're already paying out for this one in-home care agency, but they're not on your registry. And our answer is, well, we will ask them if they would like to join our registry. And we do that. We reach right out to the agency, and if they are willing and do the paperwork, then, you know, as soon as that's completed, the caregiver can go ahead and get a break from actually paying for the agency that they've been using all along. And we tend to make the time limit flexible on that too, because it does take a little while for agencies to get the paperwork done. And that's you know, that's also true for other types of organizations like therapeutic care or camps or whatever. So we can't look indefinitely. We will give people, we'll say, okay, we'll look at these people, but you also have to keep looking at the registry, because there's no guarantee that your current organization or the one that you're interested in is going to want to join our program. So that's kind of a balancing act, and it kind of is a pro for the caregivers. It's kind of time intensive for us. So next slide, please. Well, for a lot of caregivers, the big con is that they can't use family, friends, or individual providers. And that actually eliminates a lot of people from even applying. And since we don't have any data on people who don't apply after reading our eligibility requirements, we don't know how many people that's a barrier for, but I suspect since we get a lot of questions about that, it's probably a con. People may not find a provider on the registry that meets their needs. And in that case, they have to regretfully decline to use the voucher. They don't get a chance to use the money. Again, another con is probably the time limitations. On the other hand, we do find that if we don't, you know, if time limit is not given, or if people are repeatedly given extensions, then the money does never get used, and whatever barrier is keeping the caregiver from doing, you know, getting a provider, it just tends to drag on. Another con is the caregiver's responsibility. They don't actually have to do any payments to anyone, but they are responsible for selecting the provider, tracking the hours themselves, and making sure that they're not going over the limit of their voucher. If they do go over, they, you know, the providing agency or organization may very well bill them for the difference. The other con is that as hard as we try, there are areas of the state where we do not have as much depth of providers or variety of providers as we would like. We are constantly recruiting, but there are some areas that are, you know, out there in rural or remote land that don't get a lot of coverage. The other con is there's only one voucher per family per year with that dollar limit of $1,000. And if a family has more than one individual that they're trying to provide care for, that voucher gets split. So it can end up being not very much money for the care of each particular individual. So next slide, please. So on our end, I can't call these necessarily cons, but these are just things that we're aware of. We have, you know, all the organizational and paperwork stuff happens on our end. And we have a very lean team. So getting coverage for, you know, if I go on vacation and my colleague Colleen has to cover me if I'm going to be away for more than a few days, you know, she has to have specific training on the whole interface with our accounting department and so on. On the plus side, we really do feel it eliminates a cost barrier for our voucher recipients. When people apply, there's like a little mini survey where they talk about, you know, why and, you know, how long they've needed respite for and what's their main barrier to getting it. And like over a third of them give the primary reason is they don't have the money to pay for it. So that's pretty much what they say. And next slide. And here you have, and you can, you know, when you get these posted, you can click on the QR code, type in our URL, and these three highlighted areas on the screenshot of our website, the voucher program, which is for the people that are applying, the registered providers page, which is where people search for a provider, and a dedicated page for the agencies and organizations that contract with us to provide the services. And then the big blue button is our executive director's favorite, Find Respite. The big blue button sends you right to the registry. So, and anyone can use the registry. Anyone, you know, in Washington State that wants caregiving, they won't necessarily have a voucher, but they will know that everybody on the list has agreed that they, you know, made a commitment that they background check their employees, that they have insurance liability coverage, and that their people are trained for the services that they provide. So that's reassuring. And we do know that we get people using it that are not, you know, that are not registered recipients of the voucher. So that's it for me. And I'm going to turn it back over to Jill. No, well, yes, no.
No, thank you, Barb. That was great. Very helpful. I'm now going to pass it over to Aida Stevens from Oklahoma. Go ahead, Aida.
All right. Hello, everyone. I'm just so excited to share the labor of love like many of you. I'm so thankful to also have an amazing partnership with our state partner, Oklahoma Human Services, and actually a great team out of Sooner Success out of University of Oklahoma. But before I get started, I've got Stephanie and Donnie on. I just want to just allow them a quick minute to introduce themselves, because I'm sure, like so many of you, there's no way we could do this alone. Thankfully, we don't have to. Here in Oklahoma, we've got a great partnership and a great team. So Stephanie, Donnie, if you can quickly just say hello and your position.
I am Stephanie Red Elk, and I am a county coordinator with Sooner Success, and I'm also the Lifespan Respite Voucher Coordinator.
Great, thank you. We've got a new team member. Donnie, do you want to introduce yourself?
Sure. Good afternoon, Donnie Lewis, and I am the program manager for the Lifespan Respite. And I'm just came on board about 2 weeks ago, so I'm still learning.
Yes, thank you both. I just kind of put them on the spot, but I just wanted to give them that opportunity. So Jill, if you're ready, we can go ahead and pull the slides up. And just super excited to have the Lifespan Respite Grant Voucher Program in Oklahoma. And just for those newcomers who aren't aware, we do partner with Oklahoma Human Services. That's Donnie's position. And it's actually Aging Services, but the new updated name is Community Living, Aging, and Protective Services. And as I mentioned, we're out of the University of Oklahoma. So Jill, next slide. So again, when it comes to partners, we do have some amazing partners in Oklahoma. And actually, years ago, we did a needs assessment. We surveyed both providers and caregivers and really just wanted to hear from them. Respite was identified as the top need by both caregivers and providers. We also utilized that survey data to then develop subcommittees to address some of those key areas that caregivers and providers reported. And so we do have an amazing coalition. We meet really with so many partners that we're in regular contact with. We believe in just that no wrong door approach, in that if a family caregiver contacts us, we want to have the information. And we have, I think we have 10 statewide respite programs now. And Stephanie does a great job at connecting with those statewide respite coordinators to refer over, just so we're streamlining that connection and really just trying to be more efficient in the services and care coordination that family caregivers are needing. So if you're interested, we do have a respite locator on the OK Cares website. And we also, again, use a respite referral link. We utilize a platform called RedCap. It does have the PHI safeguards in place if you're interested in that. So that's the referral that those other statewide respite coordinators would send. Next slide. So just real quickly, we're about 21 years out, going on to 22 later this year. As a program, Sooner Success, we are out of the developmental behavioral pediatric section out of University of Oklahoma. Many of us are family caregivers ourselves, and all of us are committed to helping family caregivers. Just real quickly, my daughter is there at the park on the right. Her name is Mahaya. That means teacher in Creek. And I always say she has taught us so much. And we're just so blessed to, of course, have her and 3 other children. And the other 2 are also family members of team members. And these pictures were taken in the community because we do work actively to have community inclusion. Next slide. Okay, so again, this is probably not new information, so I'll just jump right through it. Who is the caregiver? Under the Lifespan, as all of you know, it is to fill the gap. And Jill, if you click on it, it'll pull the other bullet points up. So up to age 59 is our program, and 60 and older are our AAA partners. And of course, as I had already mentioned, if a family caregiver contacts us and meets eligibility for either AAA or another program, we are going to do our best to connect them to respite. And as you all know, under Lifespan, we can help grandparents and other relatives raising a child. So we do really just try to do our best to meet those family caregivers where they are and work to connect them to respite. Next slide. So really we're self-directed, and I'm so appreciative. I love this collaborative. I love learning from all of you. Here in Oklahoma, we are set up to where the caregiver, if they meet eligibility, they determine who's going to give them respite. So specifically to our program, if they meet eligibility, we would start an online application that's pretty simple. We get feedback from caregivers that it is, it's short, it's easy to complete. They also do a pre-survey, so we're collecting that data. And of course, it is for those that are 18 and older that do not meet eligibility for another program. And in the event if they do, of course, we're going to get them connected. We do have an annual household income cap of $125,000. However, if a family caregiver were to contact us, we will absolutely take into consideration any challenges that their family may be facing. And just that's something we've had to incorporate recently again, due to just really trying to limit the funds, stretch them out, so to speak, because of course, all of you on here, there's just such an uneasy feeling when you run out of funding. And it's just this constant balance of trying to keep services going. Next slide. So the care receiver, it's pretty straightforward. Again, maybe similar to your programs. They do need to meet a level of care requiring that they have a special health care condition or a disability that requires 24/7 care. And again, as I mentioned, up to age 59. And those that are 60 and older, we would absolutely connect them to the area agency on aging. And so next slide, Jill. Okay, so this is, I think, what is maybe most helpful. After the caregivers determine who's going to provide respite, and it's really just having that conversation with family caregivers to think outside the box, because we're well aware respite is defined very uniquely by caregivers. And I always have to say, I love my job, but it is not respite. So we try to talk to them about maybe there's a camp, therapeutic writing program, an art class, perhaps a fun activity that their loved one could access while they're getting that respite, that break. If they're eligible for our program, they can actually receive a $300 respite voucher. And they decide, as we said, to determine who's going to give them the break. They also negotiate what that rate is. Now, obviously, if they're accessing a program, that's going to be a set rate. But perhaps if they're utilizing a family member that lives outside the home, a friend who is willing to give them a better hourly rate, it really is determined between that caregiver and the provider. We just ask that they communicate. Respite has to first occur, and then the voucher is submitted to us, and we pay the respite provider directly. We do use a fiscal agent. It has allowed us flexibility, family caregivers flexibility, to really either use one respite provider with their voucher, or they can decide to use multiple. So utilizing a respite voucher, I think it really does help us stretch those dollars, but also be flexible for their unique needs. As I mentioned, out of the University of Oklahoma, we intentionally partnered with a fiscal agent so that we could have that flexibility for family caregivers. Next slide. Okay, so just again, some of this I already touched on. If they're eligible for our program, they can receive a $300 respite voucher. If they do have more than one loved one, we actually can increase that voucher by $100. They have 3 months to utilize this voucher. We have caregivers, they may utilize a little each month, We have caregivers that might utilize it in a weekend. It really is directed by their preference and their choice. And I know there may be questions about taxes. Our fiscal agent does provide that tax statement to respite providers at the end of the year, and as they will have to count that as income if it exceeds that $600 threshold. And so that's just something that I wanted to share. I know that question comes up a lot, but I think respite providers that we work with and even family members, now there are no surprises. If they have accessed our program, if they've helped a caregiver before, they're not typically surprised. But Stephanie does a great job at that onboarding and just really sends them that information so that they're well aware if they are a new respite provider. Okay, next slide. So data, data, data. Of course, all of you on here may agree. Data is so important for us to, of course, collect both quantitative and qualitative. In our voucher surveys, I think we've been able to just really get that information. And I will say, generally, it's very positive. Caregivers absolutely appreciate the opportunity to access respite. And of course, we get the occasional, I could always use more, which who doesn't? And so we absolutely do review those surveys and do try our best to make changes when we can. And so if you're interested in our pre and post surveys, we are happy to share that. And of course, self-reported, one of the questions, did accessing respite reduce your stress level? Overwhelmingly, we always see very positive feedback and results on that question. Next slide. Okay, so this is, it personalizes those numbers. I'm not going to read this verbatim, but perhaps you recognize even similar feedback from caregivers. I know when you look at data, and marriages that have a loved one with a special health care need tend to have a higher divorce rate. So, respite could also be a way to perhaps strengthen marriages and relationships. And of course, we find, and I'm sure you would agree, it really benefits the caregiver, but it also benefits the entire family unit, including our siblings. We, for the sake of time, we're just sharing about our respite voucher program, but we also have sibling supports. And I can't emphasize enough the importance of helping our siblings. And the data does show if we can support them, they do have a high likelihood of being a decision maker. And if we can support them when they're very young, hopefully we're helping that relationship with their sibling with special needs. Next slide. So just real quickly, I know, Jill, I apologize, I think over 10 minutes, but just want to let everyone know we have offered educational vouchers. So in Oklahoma, like maybe we have some great trainings, but we find that, for caregivers to be able to access those trainings to help them, offering an educational voucher, $50 for a half day, $100 for a full day, so they can have someone care for their loved one and they are able to attend that training or conference that's beneficial to their caregiving. The other is, as I mentioned, we coordinate with other statewide programs. However, we can offer an emergency voucher. Let's say we make connection to a caregiver. They're really a better match with our developmental disability services respite, but because of their current situation, and we know it's going to take time, and perhaps they're dealing with an unexpected event, we can approve an emergency voucher so that we're not duplicating services, because that's, of course, important. But we are trying to provide that emergency respite in their time of need. And so again, we do have a $300 emergency voucher. And again, because of time, I can't really get into it, but actively we are working on community respite programs. We also have a caregiver retreat that our previous partner talked about. And so it is our commitment to, of course, offer respite vouchers, but look at building capacity, and that includes community respite programs. Next slide. Okay, and really just to share, we do have an amazing bilingual team that many of them, again, have that firsthand knowledge and experience with lived experience as family caregivers themselves. We do also have Supporting Minorities with Disabilities Coalition. We are really trying to strategically reach our underserved caregivers. And I would say not only our minority populations, but also our rural communities. And so again, I just wanted to share that we are actively looking at strategies, implementing different programs to try to reach them, because we do look at the data. And of course, we want to continue to increase the number across all race and ethnicity to access respite. Next slide. Okay, and that's really just my contact information. It is a lot to cover in a short amount of time. I've actually had the privilege of meeting with some of you in separate meetings. And so if I shared anything that you have questions on, Stephanie and I, perhaps even Donnie, we would absolutely love to connect, because I know we covered a lot in a little time. But I certainly appreciate this collaborative. We have learned so much, and just want to say thank you to Jill for allowing us to come together. And I just look forward to maybe going into the breakouts if we have time, and would be happy to answer any questions.
Thank you, Aida. We do have quite a few questions in the chat, so let's try to get through those before we decide if we have time for the breakout sessions. The first question I think is for Lisa, and it comes from Jenny in South Carolina, and she'd like to get some clarification on the use of the term grant versus voucher, and why you use grant instead of voucher.
That's a good question. You know, I used to work in housing, affordable housing, and was on a commission for the Appleton Housing Authority. And I think a voucher as some people would use 6 months to find out where they could use their voucher. So I always think of it as people would be limited in accessing dollars, because the housing authority would never know if the voucher was going to be used, when it was going to be used, and for how much it was going to be used. So we wanted to work into things into more finite timeframes, known amounts, and with some limitations. And so to me, that's the difference between a voucher and a grant, but other people may have a different interpretation.
Do you think grant has a more positive connotation for family caregivers? Possibly.
You know, it's well received on our end. I will say from a tax perspective, and some other questions. We spoke with our auditor, and even though, so we do call it a grant is specifically called out in the 1099 requirements. Our auditor provided us with the IRS language. And even if we award a grant to a family caregiver, but pay a provider agency directly, that's still an award or money on behalf of that family caregiver. Even though it doesn't go through their hands, they should still get a 1099. So it's a grant or award. I'm not sure it calls for vouchers, but we play on the side of caution and collect W-9s from everybody. But I'm not sure I answered the question correctly. It seems to get be well received because of the dollar amounts that we average. You know, our average award is almost $1,600. The average hourly rate is around $21. So with the flexibility of paying $15 to $27, and and our average is 76 hours per application. So the grants seem to be well received.
Thank you. That's very helpful. I hope that answered your question, Jenny. Another question for Lisa. Lita from Arizona would like to know what your eligibility and authorization requirements are when you do pay up front for respite.
You know, that's a great question. You know, a lot of times, you know, if we've got a family caregiver that's stressed and sobbing and, you know, we're kind of emotional reactors. For the most part, whenever we're paying upfront, it's usually, we deal a lot with child protective services, adult protective services for children and adults who are at risk for abuse or neglect. We help grandparents and relatives as caregivers and also foster care. And usually it's a situation like that where it's an emergency situation where they need support or services within 48 hours. And so that is when we will pay upfront. So it's not like set criteria, kind of case by case basis, but that has generally been the norm.
Thank you. We had several requests, Lisa, for your sharing your caregiver experience survey questions. And since we have so many, I'm wondering if you'd be willing to share and we can post them on the Arch website under Lifespan Tools.
Absolutely.
Where if all of you are looking for surveys, we have many, many surveys that are used in voucher programs that you can access on the website under voucher tools as well as under performance measurement.
Yep, absolutely happy to share that.
That would be
happy
great.
to share anything.
That would be really great. Let's see what's next. Cheryl also asks Lisa, at what point are family caregivers told to line up their provider? Are they aware to do so while they work through your process? And what help, if any, do you provide to those who are looking for a provider? Great question for Lisa.
Our process happens pretty quickly. We do a turnover. If we get the forms, you know, pretty quickly, we can turn over a response within 24 hours. However, so there's a, most of the time, we have a how to apply form on our website. And I was emailing staff while I was talking to you guys, because I'm saying, you know, it doesn't specifically say this. We need to have it specifically say this. So we're going to change that. But for the most part, they normally get it at the time that they receive the application. So they're determined to be eligible, and the county or the ADRC says that they have tried to apply for long-term care programs, but were unable, or funds have been exhausted, or for whatever reasons, the county or the ADRC verifies that, then they're able to apply to us with the grant application. And on the grant application is when it asks for, a lot of people use multiple providers, so they're able to identify the providers and the dates the specific providers are going to provide care, and the rate that they're going to pay the individual providers. So it's a little bit comprehensive. And if they have any issues with it, both Rachel and Leslie walk them through the process. But I asked them if they get a lot of calls on that, and they said they really don't. But they're aware of it at the time that they start their application process. But we're going to change it because of your question, Cheryl.
And you also have, you know, your respite registry that provides an enormous amount of information to providers who don't have their own networks of support to select from.
Absolutely. And we just touched base with Kevin Coughlin with the state of Wisconsin, and we're going to be tying our registry in with their registry that they're doing with their caregiver connections and with the CLTS provider preferred provider list. And so, yes, we have access to a lot of resources that family caregivers can search for providers.
Wow, that's very exciting news, Lisa. That's great.
Yeah.
Maybe Aida, you could talk about that as well, since your program is so self-directed and families can choose. If they don't have their social supports in place, do you help them find providers also?
We absolutely just try to have that conversation to brainstorm ideas. More oftentimes than not, there are individuals, trusted individuals within their circle, using the example of a paraprofessional, perhaps that is assisting their child in school. perhaps they would be willing to offer respite outside of school hours. And again, just asking them about, are there therapeutic writing programs, art classes, karate, other fun educational activities that their loved ones can access? Because honestly, it's just so, maybe that's an hour, maybe it's 2, for them to think about what allows them to have a break. But yes, Jill, it does come up. I do know it's a question that we ask on our pre-survey and post, because we're absolutely wanting to have those conversations if they ask, but we're also watching to see their responses. Our team is always great at just trying to help them think through that. More oftentimes than not, it's really just broadening their thinking around what might, be fun, because they may not be thinking of other activities that benefit their loved one. They're thinking about their themselves just getting that break, if that makes sense. So yes, we do have those conversations. Now, because of liability, we've been unable to post actual respite provider list, but we do have a camp list, just having those resources in an organized way for caregivers to access really does get them thinking more outside the box.
You have sort of a related question from Cheryl in Nevada, who asks, as a GAP program, Aida, how flexible are you? And a family might qualify for another agency program, but it doesn't provide respite in a way that they can access.
That's actually a great question. As I mentioned earlier, we do coordinate with those other statewide programs, and they are also self-directed. So they allow that flexibility for caregivers to also decide. They also have that every 3-month voucher time frame. And we do try to align and have regular communication with those programs. Now, using the example of perhaps they are a match for another program, but it's going to take time for them to receive their typical voucher set, we will absolutely try to work with that caregiver if they're dealing with some higher stress levels at this time. Or, as I mentioned, Stephanie is so great about contacting those statewide programs to perhaps really try to help that caregiver access another program faster. But I guess the easiest response is that those other statewide programs also offer flexibility, and they are self-directed.
Great. We have another question, and I think this is directed to Barb about, given the amount of your voucher, how do you get around tax laws for that amount? I'm not sure you are getting around the tax laws.
No, we absolutely are. And this goes back
Okay.
to the question that was asked of Lisa about the difference between a grant and a voucher. All right, because of the way we're structured and related to what you said about, if a family has been given a grant, even though you guys are paying the provider, let's say it's a big agency or something like that, you still ask the family for the W-9 or, that kind of thing. Well, there is no way any of our voucher recipients can use the voucher with anyone but a contracted provider. Okay, if they can't use it with a contracted provider, the money disappears from them. Okay, it's only available for that. An example that's not identical but parallel might be a Section 8 housing voucher. You've been in the housing situation. Housing voucher is not counted as federal income for any of the recipients of that voucher. It's different if you're the landlord. And in Washington State, we don't have a state income tax with different parameters than the federal. And under federal law, our voucher program does not qualify as income. So that's how I tend to explain it to people. Just, and it's only due to the particular situation of our setup. It's certainly not true in other states. And it's certainly not true if money is ever given as a grant, or even if it's called a voucher, if it's ever given or reimbursed to someone directly. But it's kind of like, it's pretend money. You can use it, but only for this. It's real money for the providers, but the voucher recipients only get to use it. So that's my best explanation. I hope it makes sense.
Does that answer the question for folks? We had one more question, and I think it applies to maybe all of you who limit eligibility to family caregivers who aren't receiving services elsewhere. How do you find out if they're receiving services elsewhere besides just self-reporting?
Well, for us in Wisconsin, that is why we engage directly with the counties for the Children's Long-Term Care Program, or the county state funds, their COP or KIP funds. And then that's why we engage with the ADRCs to see if they've engaged with a long-term care waiver program, or the NFCSP or Wisconsin state-funded AFCSP. And we'll even go so far as if we see a county saying, well, they're on hold waiting for these other funds to be spent. We hear of some counties saying, oh, funds have been exhausted, when they're really on hold. And then we learn that they're not being spent. And so we'll call Lingall and just say, what's going on? Because that's where she falls into place. So we'll go so far up to say, well, what counties are generally not expending their funds? And so we'll try to make sure, we always say that we're the funding of last resort, not the path of least resistance. And so we go the nth degree to make sure that, one, we want to set them up for long-term care sustainability. And two, if they are truly on a wait list, we will definitely support them. But we rely on the counties, a government official, to acknowledge that they've applied or tried a particular program.
Does anybody else have any questions they'd like to come off mute and ask if you didn't have a chance to put it in the chat?
Jill, just real quick, I see a question asking me about the $300. That is,
Oh, yes, go ahead.
$300 every 3 months. So caregivers potentially could access $1,200 annually. And if they do have more than one loved one, they can actually access up to $1,600 annually on the typical. And as I mentioned, educational vouchers, they can access $300 annually. And of course, the emergency voucher up to $300 annually. So hopefully that clarifies. And it really just comes down to budget limitations, as we all know, just really trying to do our part to help those caregivers. And of course, with Jill is well aware, and she's always great about telling us about funding, because the need always outweighs the actual funding. And that's why we also actively work on community respite programs. But that is a good question. Just wanted to answer it as quickly as I could.
I have a question for you, Aida, and this is really honing in on this reimbursement as a barrier issue. I have heard from so many of our grantees that they have selected the method of reimbursement primarily because of liability issues and employer issues. If the family caregiver is the person who's paid through the voucher program, then the family caregiver becomes the employer, and the state avoids some liability, as well as Department of Labor requirements about minimum wage, overtime hours, all of that. And I'm wondering, how do you deal with that? Because you are paying the providers And I understand in Washington, it's different because you're paying agencies, but in Oklahoma, where you're paying individuals and family members, how do you avoid being considered the employer?
You know, that's a great
Having to meet
question.
very strict labor laws.
Well, and again, I think it's because upfront, it's very clear caregivers determine who's going to provide them respite. They're ultimately responsible and in charge of who is going to care for their loved one. And so in our experience, I believe that has allowed those caregivers the flexibility, of course, to make that decision. And our team is always great at making sure that they're well aware of safeguards that they may want to take. But oftentimes, and again, we've looked at that data, many times it is a relative or it is a program that is licensed. So I do believe that is maybe how that has worked so successfully. Now, those respite providers do get that tax statement. And again, up front, we're always clear that that is going to be sent to them. So, Jill, I don't know if I'm answering the question as detailed as you were hoping, but ultimately it's the responsibility of the caregiver. They are making that decision. We are accessing grant funding to pay for the respite. So
Okay.
that's how it has worked.
Do you document any of that with the caregivers? Do they have to sign something that says, I recognize I am the employer?
So Stephanie, if you're on, I know that we have like a liability disclosure that caregivers have to acknowledge. I don't know that we use the term employer, but we do get an acknowledgement that the caregiver understands it's their responsibility. But we don't use employer of record as a term, do we, Stephanie?
We don't use employer of record as a term, but we do have a liability statement on the application that they sign.
That they have to acknowledge.
Yes.
Thank you, Stephanie.
I think also using a fiscal management agency helps deal with some of those issues.
And they're a nonprofit as well. It's our community partner. They're now Woven Life. They're formerly Easter Seals. And so they're already serving caregivers. And it has just been a great partnership for them to serve as the fiscal agent. But I think you're right, Jill. It has worked well because of that as well.
Yeah. Excellent. Anyone else? I think, Toy, you had your hand up. Do you still have a question? No, she put her hand down. I guess not. And Lita, I don't want to put you on the spot.
Sorry, I missed and clicked it. I didn't have a question. I'm sorry.
Oh, that's okay. That's okay. I just want to make sure I didn't miss any questions.
Yes, ma'am. Thank you.
And Lita, I don't want to put you on the spot at all, but you were the person who raised this wonderful issue at the Respite Summit. And I'm wondering if some or any of your questions were answered today by the presenters, or if there's something additional you would like to know that might be helpful.
Thank you. Just hearing the presentations, it is really, really helpful when it comes to, especially, just making sure that the person is able to sign up for services, one, and then be able to select a provider of choice. With our rules and regulations now, since we have our grant, facilitated by the Arizona Caregiver Coalition, they do a really good job in terms of assisting the caregiver through, the different navigations for respite care, and then also offering training information to the caregiver. So there is a potential for the caregiver to be on the career pathway, depending on if they do want to become a hired, contractor or subcontractor. But I think right now, Dr. Nelly, I know you're on the call. If you want to speak a little bit more to some of the, applicability of, the things that were talked about in this presentation, that would also be really helpful from your perspective.
I'm not sure if she's still on the call. Is she? Okay, we'll move on. We have a couple of raised hands. Alexis, did you have a question?
Yes, just wondering, can we talk a bit about the surveys as far as the pros and cons of having it be an extra administrative burden versus the benefits that you attain from those and what you are doing with the results? I'm assuming it's for marketing purposes to get more respite voucher utilization. If any of you could talk about that quick.
I can tell you that our caregiver experience survey has all to do with caregivers getting any sense of relief, whether it be financial, emotional, spiritual, physical. It's in these 8 dimensions, and it's really focused on did they see an impact as a result of our respite intervention. And certain ones are always higher than others. But it certainly guides us in our model. I guess that it would apply to us when we request or apply for grants, that we just have such strong due diligence, and we rely so heavily on data to guide or amend our model or our practices. I always say numbers tell a story, and the feedback from the caregivers really tell us a story as well. And it's only, it might be 10 questions, so it's not overwhelming. But we do look at that and gather that from every single person. So the value definitely, we've never had an issue with somebody refusing to apply, complete it.
Yeah, and I would agree. Data is just so important for us to collect. Of course, it's a grant requirement, but it does also allow us to improve our services. So we do actively review those results, and where we can, we try to make changes. It is online. Unless the caregiver doesn't have access to internet, we can actually mail it. And just even the printed copy is very short. So we do try to be mindful of how long it takes. It doesn't take long. It's just a few minutes, because we're also aware everyone has survey fatigue. So we try to be mindful of that. But it is very helpful. I would recommend anyone to, even if it's 3 questions, like, you would be surprised in their own words. Oftentimes, caregivers can really show the impact. Because we're always trying to quantify the impact, but it really tells a story to those numbers. And so I highly recommend incorporating some level of survey, because you will get that caregiver voice. Even if you're a caregiver yourself, it's just very interesting on the unique responses.
I could not agree more, Aita, with what you're saying. We use our relatively short survey, which is sort of in the middle in length between yours and Lisa's. And, we do use it for reporting. We do use it when we look for other funds, but primarily we look for the responses that tell us what was marvelous and, of course, what was less than marvelous. And we move our program if we can. And people are very kind in general. They're brutally honest, but they'll say things like, "Oh, this provider just totally didn't work out, but we know that was not your fault." So yeah, I agree. I think getting feedback from the caregivers using your vouchers or your grants is crucial.
Thank you.
You're welcome.
Oh, Jill, your mic.
I just noticed. I was just saying such excellent questions today, and we've had a really fantastic discussion. I'm sorry we didn't have a chance to break out into smaller groups, but the group kind of turned into a smaller group. Anyway, so thank you all for being willing to ask your questions, share your own insights, and thank you very much to our presenters for your willingness always to share this information. If anything jumped out at you today that you'd like to know more about that we didn't touch on today related to vouchers, please let us know, and we can target the next voucher learning collaborative to your specific needs and desires for more information. So please let us know. With that, any last minute comments from our presenters you'd like to share? Lisa did put some information that she's received from her auditors on tax related issues in the chat. And I will also make sure that you all get a copy of the chat, because there was a lot of substantive information in the chat and some really great questions too.
Excellent. I
Great,
would just
thank you.
say, yeah. Oh, I'm sorry, Ada.
No, go ahead, Barb.
I would just say, you know, I know Jill's going to be posting the slide deck, and our contact information can be found through the links on my final slide. And I think we all had a way of getting in touch with us. So if people have questions specifically about, you know, our type of model or the other, I think we can all say we can answer things offline.
Yes, we're available. And I think that's a good segue to what I wanted to share. Please reach out. We're happy to learn from you and to also share. And we have an open door, so that's always available. Thank you.
Ditto.
Thank you all very much. And I will give you 2 minutes back of your afternoon. And again, thank you to our presenters. Thank you to our Learning Collaborative participants for another great session. Thank you all. Have a great afternoon.
Thank you,
Jill.
everyone.
Bye.
Thank you, Jill.
Bye.